NCSBN NCLEX practice questions with answers. Pass your exam fast. Question 1. The nurse is assisting with the delivery of a newborn infant. What is the priority nursing intervention for a normal newborn immediately after delivery? Option A. Dry off infant with a warm blanket or towel. Option B. Apply identification bracelets. Option C. Assign the 1-minute APGAR score. Option D. Obtain vital signs. The correct answer is option A. Dry off infant with a warm blanket or towel. 1. Dry off infant with a warm blanket or towel. Question 2. The registered nurse is teaching a childbirth education class about postpartum depression. Which statement, made by a class member, indicates that more teaching is needed? Option A. I will make an effort to talk with someone about my feelings if I start to feel overwhelmed. Option B. It's common for women with postpartum depression to have delusions about the infant. Option C. Women with postpartum depression have feelings of guilt and worthlessness. Option D. I may experience postpartum depression up to a year after delivery. The correct answer is option B. It's common for women with postpartum depression to have delusions about the infant. 2. Question 3. The nurse is reinforcing information about the side effects of fluoxetine to a client. Which group of findings should be included? Option A. Diarrhea, dry mouth, weight loss, reduced libido. Option B. Tachycardia, blurred vision, hypotension, anorexia. Option C. Orthostatic hypotension, vertigo, reactions to tyramine, nausea. Option D. Photosensitivity, seizures, edema, hyperglycemia. The correct answer is option A. Diarrhea, dry mouth, weight loss, reduced libido. 1. Diarrhea, dry mouth, weight loss, reduced libido. Question 4. A client has a diagnosis of heart failure. Which intervention is most important for the nurse to implement prior to the administration of digoxin? Option A. Use the pulse reading from the electronic blood pressure device. Option B. Take a radial pulse, counting for a full 60 seconds. Option C. Check for a pulse deficit at least twice with another nurse. Option D. Assess the apical pulse, counting for a full 60 seconds. The correct answer is option D. Assess the apical pulse, counting for a full 60 seconds. For assess the apical pulse, counting for a full 60 seconds. Question 5. A client diagnosed with bipolar disorder refuses to take the prescribed medication. Which is the most therapeutic response by a nurse to the client's refusal of the medication? Option A. You need to take your medicine. This is how you get better. Option B. What is it about the medicine that you don't like? Option C. I can see that you are uncomfortable right now, let's talk about it tomorrow. Option D. If you refuse your medicine, tell me how do you think you will get better? The correct answer is option B. What is it about the medicine that you don't like? 2. Question 6. A parent expresses frustration and anger about the toddler constantly saying no and refusing to follow directions. The nurse should help the parent understand that this behavior meets which developmental need? Option A. Self-esteem. Option B. Initiative. Option C. Independence. Option D. Trust. The correct answer is option C. Independence. 3. Question 7. The LPN is assisting the RN to provide care for a client diagnosed with a traumatic brain injury. Using the Glasgow Coma Scale, when the client does not obey verbal commands to move, which technique will the RN use to evaluate motor function? Option A. Squeeze the trapezius muscle firmly. Option B. Lift the client's arm and observe for pronation and drift. Option C. Apply fingertip pressure for 10 seconds. Option D. Rub the sternum with the knuckles. The correct answer is option A. Squeeze the trapezius muscle firmly. 1. Squeeze the trapezius muscle firmly. Question 8. A newborn has hyperbilirubinemia and is being treated with a Billy blanket. Which intervention is indicated during this therapy? Option A. Discontinue breastfeeding during treatment. Option B. Rotate the neonate to treat all of his/her skin. Option C. Restrict holding the newborn during treatment. Option D. Provide more frequent feedings. The correct answer is option D. Provide more frequent feedings. For provide more frequent feedings. Question 9. A client with paranoid delusion stares at the nurse over a period of several days. The client suddenly walks up to the nurse and shouts, "You think you're so perfect, pure and good." How should the nurse respond? Option A. You seem to be in a bad mood. Option B. Perfect? I don't quite understand. Option C. You sound angry right now. Option D. That explains why you've been staring at me. The correct answer is option C. You sound angry right now. 3. Question 10. The client with coronary artery disease has a prescription for nitroglycerin transdermal patches. What is the best reason the client should not wear a patch for more than 12 to 14 hours each day? Option A. It can cause severe headaches. Option B. It may no longer work as well. Option C. It will cause profound hypotensive effects. Option D. It will irritate the skin. The correct answer is option B. It may no longer work as well. 2. Question 11. A hospitalized infant is receiving gentamicin. Which nursing intervention should receive priority in the plan of care? Option A. Compare daily infant weights. Option B. Monitor the infant's urine output. Option C. Ensure appropriate fluid intake. Option D. Maintain accurate intake and output. The correct answer is option B. Monitor the infant's urine output. 2. Question 12. A newborn is diagnosed with hypothyroidism. In discussing the condition and treatment with the family, the nurse should emphasize which point? Option A. They can expect the child will be mentally retarded. Option B. Administration of a thyroid hormone will prevent problems. Option C. This rare condition is hereditary. Option D. Physical growth and development will be delayed. The correct answer is option B. Administration of a thyroid hormone will prevent problems. 2. Question 13. A child is admitted to the hospital for emergency surgery. The child's parent reports several allergies. Which of these allergies should all the operative healthcare personnel be notified about? Option A. Perfumed soap. Option B. Shellfish. Option C. Balloons. Option D. Mold. The correct answer is option C. Balloons. 3. Question 14. A practical nurse, PN, team member identifies that the fundus is boggy for a woman who is gravida 4 para 4 and is 2 hours after a spontaneous vaginal delivery. The fundus is displaced slightly above and to the right of the umbilicus. What should be the initial nursing action? Option A. Assist the woman to empty her bladder. Option B. Monitor the pulse and blood pressure. Option C. Call the registered nurse, RN, immediately. Option D. Check lochia for color and amount. The correct answer is option A. Assist the woman to empty her bladder. 1. Assist the woman to empty her bladder. Question 15. The nurse is planning the therapeutic milieu and the various activity groups for a client. What is the primary goal for the nurse to consider? Option A. Diminish destructive behavior through peer pressure. Option B. Plan strict schedules with defined expectations. Option C. Punish inappropriate behavior as it occurs. Option D. Achieve a client's therapeutic goals. The correct answer is option D. Achieve a client's therapeutic goals. For achieve a client's therapeutic goals. Question 16. A client tells a nurse, I have something very important to tell you if you promise not to tell anyone. Which statement by the nurse would be the most appropriate response? Option A. That depends on what you tell me. Option B. I must report everything to the treatment team. Option C. All right, I promise. Option D. I can't make such a promise. The correct answer is option D. I can't make such a promise. 4. I can't make such a promise. Question 17. A client is discharged with a prescription for warfarin. A nurse recognizes that additional teaching is needed if the client makes which incorrect comment? Option A. I know I must avoid crowds. Option B. I will report any bruises or bleeding. Option C. I plan to use an electric razor for shaving. Option D. I will keep all laboratory appointments. The correct answer is option A. I know I must avoid crowds. 1. I know I must avoid crowds. Question 18. The nurse discovers an unresponsive client and determines there is no pulse. This nurse then activates the code notification button to alert all personnel about the code and begins chest compressions. What is the function of the second nurse on the scene? Option A. Validate the client's advance directive. Option B. Participate with the compressions or breathing as requested by the first nurse. Option C. Bring the code cart. Option D. Relieve the first nurse on the scene and continue single-person CPR. The correct answer is option C. Bring the code cart. 3.